We have Dr. Sudha Prathikanti. She is a board-certified adult psychiatrist, a member of the American Board of Integrative Holistic Medicine, and a certified Ayurvedic practitioner. At the UCSF Osher Center for Integrative Medicine, she founded the Integrative Psychiatry and Ayurveda Consultation Services and currently directs the Integrative Psychiatry Teaching Clinic. Her clinical work integrates conventional psychiatry with holistic modalities, such as Ayurveda, yoga, meditation, herbal medicine, and Jungian psychotherapy. She emphasizes the psychosocial, cultural, and spiritual dimensions of healing, supporting patients through chronic illness, pain, and life transitions. Her research on yoga for depression has received national media attention. She also serves as the medical director for the primary care adult psychiatry at Zuckerberg San Francisco General Hospital. In this role, she provides consultation services to primary care providers, mentors medical and psychiatry trainees, and co-leads efforts to create accessible, culturally responsive, and holistic mental health interventions for underserved populations across San Francisco's public health system.
Thank you so much, Stephanie. All right. So we have about 50 minutes today, right? Yes. Okay. So we have a lot of ground to cover in that time. I tried to keep my slides to a minimum. Maybe if we get through everything on time, we could have maybe 5 minutes or so at the end for a brief Q&A. But the topic today is really about how Ayurvedic medicine could be useful for treating functional GI disorders. And I'm sure this is something that you're all, conditions that you're all pretty familiar with. I also should say I have nothing to disclose. And these are some of the learning objectives that we're going to be going through today. But the topic of functional GI disorders is one that I'm sure you're all really familiar with. They're really quite prevalent. It's estimated about 40% worldwide, and IBS alone accounts for half of those 40% prevalence worldwide. And then here in the US, it's a little bit better. It's more like 1/3 of the population presents with functional GI disorders. But it's still a substantial economic and healthcare burden here, and really substantially reduces quality of life. And the management of FGIDs tends to be very complex because there is often no, in fact, by definition, there is no identifiable structural or biochemical abnormalities. And so people are really searching, patients suffering from this condition are really searching for answers and often coming up short and really feeling frustrated with the toll that it's taken on their lives. So in this context, Ayurveda really offers a very valuable approach to managing these conditions because there's this big emphasis on mind and body being treated together and on factors that put the patient in the driver's seat in terms of managing their condition by emphasizing diet, lifestyle modification, herbal therapies, and so on. So what I'm going to try to do here is try to give you like a 5-minute summary of Ayurveda, which is going to be hard to do. It's a 5,000-year-old tradition. It's pretty complicated, but at the same time, there's some guiding principles that are actually very simple and very intuitive. So I'm hoping to share some of those with you right now in a 5-minute overview, and then we can dive into how from an Ayurvedic standpoint, the whole gut-brain relationship unfolds and how we would have some leverage to actually make some modifications there. So first of all, Ayurveda developed in India over 5,000 years ago, and it really offers this very holistic framework for understanding how we as human beings, actually as any living being on the planet, interacts with our environment. So any living being, including humans, are actually considered to be made up of 3 fundamental bioenergies. And these bioenergies are called doshas. And Ayurveda basically looks at these 3 doshas as existing in a unique proportion in every single person, okay? So these 3 bioenergies are required for life in everyone, but each of us has a very unique like like a bioenergetic fingerprint of these three doshas, which is unique to us. While we each have this very, very unique, very unique, non-reproduced exact proportion with another person, we also have a tendency to have one or maybe two of these three doshas dominate. So therefore, we can actually roughly categorize people as being vata dominant, pitta dominant, or kapha dominant in terms of their underlying makeup. And that underlying makeup is called constitution. And so that proportion of the three doshas that we're born with, and I should emphasize it, that we're born with comprises our constitution. Now, these bioenergies are dynamic, though. They're constantly changing in response to the environment. So we'll talk a little bit in the next slide about how that affects our psychophysiological functioning. But just to come back to this, what are these three bioenergies? So one really shorthand way of thinking about it that really works for me when I first was learning this is to sort of think about, from a Western standpoint, our physiology. We sort of think about catabolic, metabolic, and anabolic processes. And so in a way that kind of corresponds here with these three doshas and how they function on a physiological level. Vata is like the catabolic energy, pitta is metabolic, and then kapha is anabolic. So vata is considered to be made up of the air and space elements. And when we talk about elements, we're really just talking about qualities of nature, which are metaphorically described as being air and space. But they have because vata as this dosha has the qualities of air and space, it's a very light, mobile, erratic, and cool dosha. Those are some of its qualities because those are the qualities of air and space. So it governs movement and communication in the body, and specifically in the GI tract, it controls peristalsis and elimination, which is really the movement aspect of the GI function. Now, when vata is out of balance in the GI tract, it manifests with bloating, constipation, irregular bowel movements, and gas. Now, those are all qualities associated with air, because air is erratic. Like sometimes it comes whooshing in like a tornado, and other times it's just dead calm. So when there's too much vata, there's that unpredictability in peristalsis that goes along with it. Now let's look a little bit at pitta. Pitta is considered to be made up of fire and water, and it essentially oversees the entire metabolic functions in the body, like all the way from the endocrine to thermogenesis and certainly digestion. So it's directly linked, in fact, to the digestive enzymes and to acid production in the body. Now, when pitta is exacerbated, aggravated, then it leads to these fiery elements really predominating in the presentation of symptoms. So, for example, that would lead to heartburn, acidity, any kind of inflammatory condition, diarrhea. So these are the manifestations of pitta being overactive. And now we'll come to kapha. We talked about kapha being more like the correlate of anabolic processes in the body. Kapha is made up of water and earth elements, and when you think of water and earth, they make mud, which is very heavy, which is sticky, which is damp and heavy. And so these are the qualities of kapha. And so you just sort of extrapolating from those qualities, kapha really provides the structure, the cohesion, the lubrication to the entire body, including the digestive tract. And it maintains mucosal integrity and makes sure that things are well lubricated in the GI tract. Now, when kapha is aggravated or excessive, this leads to sluggish digestion because kapha is very, very slow by nature, and also a lot of mucus buildup. And this feeling of persistent fullness because food isn't getting digested. And so therefore, there's just this sensation of constant abdominal fullness. So just to rehash, all of these three doshas are required in every single person. Like we all need catabolic metabolic and anabolic functions to survive. But in a given person, one or sometimes two will predominate, and that sort of gives us a sense of what broad clusters of symptomatology we might be able to infer from being in one of those clusters based on those qualities that are associated with that dosha. So, as I mentioned earlier, doshas are dynamic. Doshas are constantly changing in response to our inner and outer environments. And there's a lot to get into there, but I'm not going to try. I'm just going to say that there is a way in which the inner elements in each of these dosha, like air and space and vata, interacts with the air and space elements outside to actually dynamically change. So in the general principle in Ayurveda is that like increases like. So if vata is made up of air and space element and you have a lot of vata within your constitution, if you are exposed to a windy, arid climate with a lot of air and space elements, like on the high Tibetan plateau or something, then that external air and space is going to aggravate or increase your own internal air and space. So vata dosha will go up. And then similarly, if you have a lot of kapha inherently in your constitution and you're exposed to a lot of qualities in nature that have water and earth qualities, then that's going to exacerbate those same qualities on the inside. So like increases like, and then opposites actually create balance. So opposites. So if you are having too much air and space on the inside, you need something heavy and warm to ground you. And so that sort of counterbalances that tendency towards air and space on the inside. So those are the principles to be thinking about. So in general, from an Ayurvedic standpoint, health is defined as those three doshas being maintained in balance with the constitution that you were born with. So when you maintain vata, pitta, and kapha through wise lifestyle choices, you maintain them in your proportion that you were born with. That's your place of strength. That's where you have maximum resilience in terms of dealing with whatever stresses come your way. But if you make lifestyle choices which throw those doshas out of balance, and you're no longer in that same proportion that you were born with, then you're much more vulnerable, susceptible to illness. And so this is why, from an Ayurvedic standpoint, our choices that we make every day, every minute, actually affect our doshas because they're dynamic, they're just energies. And so if you are, if you sort of make a few bad decisions for a couple of days, it's probably okay because the body is considered to be a homeostatic mechanism at some, ultimately, and it can sort of reset itself if it's like out of balance. But if you have a sustained imbalance over months or years, it's going to be much harder to reset and go back to that place of homeostasis. So the earlier that you can catch an imbalance and correct it, the better from an Ayurvedic standpoint. Okay, so the doshas were like one of the key concepts, key principles that we needed to explain before we get into the rest of this talk. The other big one here is Agni, okay? Agni is the digestive fire, and it's really the cornerstone of health from an Ayurvedic standpoint. It's not an exaggeration to really say that the whole treatment methodology in Ayurveda really revolves around the modulation of Agni, digestive fire. It's really the cornerstone of Ayurvedic thinking about health and wellness. And now Agni is not just, the digestive enzymes. It actually refers to the entire metabolic system, the digestive fire. But of course, it's quite concentrated in the GI tract. So this balanced Agni is really crucial for proper digestion, absorption, elimination, and it directly impacts mental clarity and emotional stability. So we say in Ayurveda, when Agni becomes imbalanced, it can lead to incomplete digestion, and then this produces something called ama. Ama is a toxic byproduct that's linked to various digestive disorders and systemic issues, okay? So ama can sometimes be gross or it can be subtle. Like gross ama, for example, could be urine or feces that we're retaining because we're not able to actually eliminate them for whatever reason. But on the other hand, very subtle byproduct of ama could be, for example, an undigested or unassimilated mental experience, a traumatic experience that's just kind of lodged in our psyche, and we're not able to expiate it. And so that is also an example of a kind of subtle of ama gets produced by that sort of this experience, but it's of a much more subtle nature than the gross ama that might be visible. Now, in this next slide, there are different sort of qualities of Agni, different types of Agni that a person can have based on their digestive health. So the first one is Sama Agni, which is balanced digestion. And this is what we all want, and this is what we're aiming for. So this actually produces optimal digestion and metabolism with regular, well-formed stools, proper nutrient absorption, and little to no ama produced, because everything that you take in is properly metabolized and absorbed, whatever is useful, and then whatever is not useful is excreted properly. So in that kind of situation, you have balance, and the effects in terms of like all of the three doshas are also the effect is that all three doshas are also in balance in that situation. Now, we also have three pathological expressions of Agni, and these are called Vishama, Tikshna, and Manda Agni. And these are actually associated with Vata, Pitta, and Kapha being in excess. Okay, we talked about Vata, Pitta, and Kapha getting aggravated or exacerbated. Okay, when Vata gets exacerbated, when there's too much air and space element, then we have this Vishami Agni, which is irregular digestion. So it alternates between indigestion and hyperacidity, and then constipation, just very unpredictable digestive patterns and variable symptoms. If we have too much pitta, that's the Tikshna Agni, then we get this excessive fire, right? Too much digestive fire. It's too bright, burning too brightly. And so when that happens, you basically end up with a lot of hyperacidity, burning sensations, acid reflux, a frequent hunger, because you're just burning through your food too quickly. And then we have too much kapha, because of water and earth elements, for example, being too excessive in your environment or in your food or whatnot. Then we have this Manda Agni, which is that sort of weak Agni, very weak digestive fire. It's sort of like if you throw a lot of dirt and water on top of a fire, what happens? It just kind of fizzles out. And that's the same thing here with Manda Agni. It basically results in very slow digestive process, a lot of bloating, heaviness after meals because you're still trying to process the food hours after you've eaten, and then a kind of lethargy that sets in thereafter. So the state of Agni, from an Ayurvedic standpoint, is very important in how our mental functioning happens, because there is a connection that we're going to talk about in the next slide between the channels of food and the channels of the mind. Those two are very, very interconnected in Ayurveda. And if Agni is balanced, then we have a balanced mind. And the balanced mind is called sattva. It's characterized by clarity and calmness. If we have this hyperactive sort of pitta type of Agni, this Tikshna Agni, then we have a lot of activity, restlessness, irregularity, okay? And then if we have too much of the Kapha Manda Agni, then we have this very like slowed down, lethargic kind of mind, because we have a lot of ama basically being built up by unprocessed food. So let's see in the next slide how exactly it is that in Ayurveda, mind and body are connected. Then this is a really central aspect of Ayurveda. I mean, for thousands of years, they've kind of like recognized this connection between gut and brain, something that we're only now recently in Western medicine really starting to understand and embrace. But this was like a core pillar, a core tenet of Ayurvedic treatment for millennia, actually. So the Srotas system in the mind body is a reference to the body's vital channels. Now, these channels can be both tangible and intangible. And these channels actually transport various substances that are essential for overall health. Now, on the intangible side, these channels can carry doshas. So those bioenergies of Vata, Pitta, and Kapha that we talked about. How do Vata, Pitta, and Kapha exert their effect? By going through this Srota system and being able to like reach every part of the mind and body. But so that's an example of a more intangible way in which these channels function. But the more tangible aspect of the Srota system, could carry nutrients, waste products, air, blood. These are all very tangible roadways within the mind body. Now, when these channels are patent and they are, and whatever the substance within it is flowing properly, then you get really balanced mind and body. But when there's obstruction, dysfunction, damage, then this is what leads to illness. And specifically, it can also lead to mental illness. And how does that happen? Well, it happens because among all of these different srotas, we've talked about there's some srotas that carry food, like the GI tract, some srotas that carry air, like our respiratory tract, some srotas which carry blood, like our circulatory system. And then we also have the Manavaha srotas, which is called the mind channel. And this basically carries all the sensory input that we take in through our five senses from the outer world, but then also allows us to then act through the mind channel in the world with that information that we've taken in. So it's important to say this goes beyond. Manavaha Srotas is actually not the same as the nervous system. There's actually a whole different channel in the Ayurvedic system called the Majja Srotas, which is actually for the nervous, the physical, visible, tangible nerves and so on. But the mind channel is a much more subtle aspect and actually is more about like the sense of consciousness, awareness, intelligence that pervades our mind body. And Ayurvedically, that sense of mind is not just limited here to the brain. It's actually a kind of cellular intelligence that pervades each and every atom of our body. And that is, and that reflects Ayurveda's idea that mind and consciousness are actually like fundamentally what we're made of. And the Manavaha Srotas is actually what allows that sense of mind to pervade our entire system. Now, in Ayurvedic medicine, I mentioned the food channels and the mind channel are very connected intimately. They actually, now the Manavaha Srotas, the mind channel, actually interacts with every other channel. There's multiple, there's 16 major channels, but the Manavaha Srotas interacts with each and every one of them because it's so all pervasive. So every other channel necessarily will be influenced by by the other one, but especially so with Manavaha Srotas because of its all pervasive nature. Now, particularly with food and mind, they're supposed to have a very particular connection in Ayurveda between food and mind. So when a person is healthy, which means when their digestion is functioning properly, if proper digestive fire is there, Agni is balanced in the food channel, then food is properly digested. You're able to nourish the body and take away any ama or toxin, and there's no more ama formation. There's little to no ama formation in the body. So when there's little to no ama formation, the mind channel is able to sort of pass through the body system unobstructed. Okay, when there's no ama being accumulated in the mind-body system through unprocessed or poorly processed food, then there is no obstruction that accrues to the mind channel. And then when conversely, when our mind is peaceful, happy, and calm, then it also promotes optimal digestion because our mind is said to regulate our stress response and our ability to actually maintain Agni's strength. Okay, so in a state of illness, when, like, for example, through excess stress or emotional trauma, the mind channel actually ends up weakening Agni because it's not actually transmitting what is considered to be sattvic qualities, those sort of calm, clear qualities of mind. The intelligence that is being delivered to all the cells of the body are not clear and calm because of impaired digestion with ama buildup, which is then triggering, triggers dysfunction in the mind channel. And then conversely, like if you have poor digestion, even if you were started out with a clear mental channel, but you have poor digestion, then you can end up with anxiety, brain fog, emotional instability because of that ama buildup. So there can be psychological ama, which builds up, which then impacts physical digestion, and then physical indigestion, which accrues subtle ama, which then impacts the mind channel. So these two really are heavily influencing one another. Now, this is a pictorial diagram of this communication between gut and brain that is recognized by both modern medicine, but also by Ayurveda. Although it's conceptualized differently, there's some parallels, okay? So I'm just going to say that in both models, the triggers at the top for some kind of gut-brain imbalance is dependent on that individual's environment, their lifestyle, and their genetic susceptibility. So a lot of the same factors that you'll see on the left-hand column that we might say are factors associated with gut dysbiosis would also probably be in the right-hand column too in terms of Ayurveda. But Ayurveda wouldn't say that these are factors that are associated with gut biosis. What Ayurveda would say is that these factors actually lead to one of the doshas getting out of balance, okay? And then when one of those doshas goes out of balance, it initially accumulates and gets aggravated in a particular spot in the GI tract. So regardless of what is the cause of the dosha imbalance, ultimately, Ayurvedically, like there's a lot of emphasis on the GI tract. So dosha goes out of balance, the seat of vata in the GI tract is the colon. If pitta dosha goes out of balance, the seat of pitta in the GI tract is like the duodenum, small intestine. And then if kapha goes out of balance, the seat is in the stomach. So when a dosha initially goes out of balance, it's said to accumulate in one of those three primary sites. And you might start noticing some first early warning signs of some kind of an imbalance. And that's going to depend on whether it's vata, pitta, or kapha that's sort of thrown off balance. So if someone's been staying up too late for too many nights in a row, not getting enough sleep, it's going to be vata dosha that's going to get thrown off because vata dosha by its very nature is already erratic. Okay, it's already very light. And so it needs rest. It needs like a lot of opportunity to restore and be calm and be quiet in order to stay in balance. So if you're staying up all night, not sleeping well, and so on, it's going to throw off vata dosha. And then that is going to show up in the colon as maybe constipation, which is a classic vata sign, because that peristaltic motion is just not working the way it should, or it's very erratic. And then if similarly, if it's a kapha dosha, that is thrown off balance. It's going to show up initially in the stomach, okay? And it's going to show up as a kind of early satiety and food just not getting, digested well right there from the get-go. So these signs of the dosha imbalance are dependent on where in the body that particular dosha is initially situated. However, over time, hopefully, if there's an early warning signal, you notice it and you correct it, okay? But if you don't correct it and it sort of builds up and aggravates, then there will definitely very quickly be an impact on Agni. And that Agni, again, will either be weak or it will be erratic or it will be hyper based on whether it's Vata, Pitta, or Kapha that is getting exacerbated. And then that will lead to, the Agni being impaired in that particular way to create like what we had seen in the previous slide. If it's really low and slow, it's going to like create that kind of lethargy at the mental level and so on. So anyway, you'll see the improper functioning of Agni is then going to lead to the buildup of Ama. And it's also going to, because Agni is also not functioning properly, the doshas are not able to, the doshas like continue to like go out of balance, and eventually we say that they metaphorically sort of overflow from their seat in the GI tract and actually start spreading through the bloodstream. And when they start spreading through the bloodstream, through other parts of the mind and body, that overflow, if it's not recognized and reversed, will definitely end up very quickly obstructing the mind channel. And that's because, as we said, the overflow of doshas will end up will end up impairing Agni even further, which will then cause Ama, which will then cause obstruction of the mind channel. And then basically at that point, at that stage, if it's not corrected, then the dosha really gets itself lodged into some remote tissue. And then in that remote tissue, it becomes established and causes characteristic manifestations of symptoms. So if it gets lodged in the nervous system, in the brain, you might start having, like if we're taking the example of Vata dosha, you might start having forgetfulness. You might feel unsettled and anxious, unable to make any decisions, have a lot of trouble with insomnia, and so on. And we say that this is a direct result of the ama in the body accumulating and not being reversed at an earlier stage. And then this is, and we have on the left-hand side, the kind of Western model. And, from a biomedical standpoint, this dysbiosis of the microbial flora is followed by permeable gut, and then the release of toxins into the blood, and then finally an inflammatory response, and a disease is potentially set to manifest, including mental disorders. So there are just some very striking parallels here, although the understanding the phraseology of like how exactly it comes about is different, but similar idea. Okay. So let's look a little bit now at some Ayurvedic correlates to various functional GI disorders and how those are treated in Ayurveda, and how we might, whether we have any evidence as to like how they might be able to work in our kind of Western medical context. So the analog to IBS is probably one of the really well-established, very old disease entities recognized in Ayurveda. It's called Grahani, and it describes a condition that basically where the pitta energy, which is supposed to be responsible for restraining the downward movement of food, like the premature downward movement of food, is impaired. And so this results in a situation where we have alternating constipation, diarrhea, abdominal pain, bloating, loss of appetite, and this clearly corresponds to a lot of our diagnostic criteria for IBS. So again, this this grahani comes about from a dosha imbalance, which then leads to weakened agni, which then leads to accumulation of ama. Okay. And then we have also two forms of amla pitta, which are pretty well correlated to functional reflux and to functional dyspepsia. Okay, so dyspepsia, so let's start with functional reflux actually. So amla pitta is considered to be burnt. It's called burnt pitta. So when there's an upward movement of the burnt pitta, it's characterized by heartburn, nausea, bitter taste, and this correlates with GE reflux. If it's a downward movement of amla pitta, then it's featured with bloating, indigestion, loose stools, and it's much more like a functional dyspepsia. So these are both different forms of amla pitta. So let's take a look at these three conditions and just see like what the principles of treatment would be, and then if there's any evidence from, studies that have been done about whether these principles are borne out to be efficacious or not. So the basic therapeutic principles for digestive health, actually for any kind of health condition in Ayurveda, really rests on these three pillars. Restoring dosha balance, so recognizing which dosha in a given person is thrown off balance and bringing it back to the proportion that it should be based on their constitution. Then reducing ama and strengthening agni. So those three become the foundation of all of these treatments, including the functional GI disorders. And then how is it that we bring the doshas back into alignment if we are able to notice early enough that they are starting to go out of balance? Well, Ayurveda puts a lot of weight actually on aligning with the sun. That chronobiology is super important in Ayurveda and has been for thousands of years. And this is called dinacharya. And so the core of it is to establish a morning and an evening routine, which keeps you in harmony with the cycles of the sun, and also to do some gentle movement or stretching in the morning to kind of activate your digestive system. Having very regular meals, with the biggest meal of the day being at midday, because we say that's when the pitta energy is the strongest, at midday. And so that's like when you should have your biggest meal. Ayurveda completely disagrees with the idea that breakfast is the most important meal of the day. Actually, at the beginning of the day, kapha is supposed to be dominant. Kapha is that really slow, metabolically very slow energy. So you don't actually want to overload your GI tract with a lot of food at that time. Just want to have something very light. You can even like skip it and have brunch actually from an Ayurvedic standpoint, because by the time you hit about 10:30, your pitta energy is fired up, and then you can actually start eating a bigger meal at that time. And then you eat a kind of moderately small dinner, and you try to have that dinner as close to sunset as possible while there's still some sunlight available to sort of give you some external pitta energy to help digest your food. And then also remember how, because of that connection between the mind channel and the food channel, stress management is considered from the beginning to be extremely important for good digestion. And so we're supposed to eat in a very calm situation. Ayurvedically, we should really try to minimize any talking. We really just eat in a peaceful manner. We don't have any input coming in from TV, radio, other people, noises. The idea is that when you're eating, you're also taking in whatever the environmental influence is at the same time that you're eating your food. And so you really want to minimize stress. You don't work while you're eating. You don't try to talk on the phone while you're eating. It's a very mindful eating is the goal. And then generally keeping your stress level down through whatever practices you would like to choose. But, meditation and pranayama, breathing exercises, are the time-honored techniques for doing that. And then, of course, the third principle is really about reducing ama and building up agni, right? And those are done by diet. And Ayurveda has a whole way of understanding, according to your doshas, what you should be eating. And the foods that are good for one person are not going to be the foods that are good for another person. So if you're someone with a lot of vata predominance, and I treat people all the time who come in and say, but I eat really healthy. I eat salads. I eat a lot of salads, and I eat these smoothies, these fresh raw food smoothies that I make for myself every morning. And those are exactly the foods that are going to exacerbate vata, because vata is cold and it is already it's already light by nature. So when you eat cold, light foods like salads or really cold smoothies, you're going to exacerbate vata dosha, and you're actually going to make your digestion even more erratic if you have a lot of vata already aggravated. So I have to really counsel patients to really shift their eating habits and to eat cooked foods, to eat warm foods, to eat really heavier stews and root vegetables and other foods that come from the ground to sort of counterbalance that vata energy in that situation. And it really takes a big frame shift for a lot of people because they're just really used to thinking that what they've been eating is healthy. And it might be for someone who is, say, a pitta. It might be perfect for a pitta, someone who has a lot of digestive fire and who actually needs cooling foods. So having, smoothies in the morning is just fine for a pitta person, but it's going to really aggravate a vata dosha, someone who has a vata as their dominant dosha. So anyway, there's a whole methodology to that, which we don't have time to get into, but this is very central to the management of digestive health in an Ayurvedic standpoint. So the dinacharya is how you get the doshas back into alignment, and then the diet is how you really reduce ama and build up agni. So let's take a quick look at some of the clinical studies that we have available. And I'll just warn you right off the top, these are not the world's best clinical studies. This is they're very much in the nascent stages. And part of the reason is because you could see that in Ayurveda, it's highly personalized, right? You treat every person according to like what their individual dosha balance is, and you work towards that. And so it doesn't lend itself, this particular paradigm doesn't lend itself to the placebo control, randomized control design, because that assumes that everyone is the same and everyone needs to get the same treatment. In Ayurveda, it's completely opposite. It's personalized. And so how can you personalize it and also, make these population health statements about the outcome? It's very tough to do. So, but we'll see what we've got here. We'll work with what we've got. So this is one of the better studies that came out I think it came out just maybe 3 years ago or so. But in this particular study, Ayurvedic nutritional therapy, so the Ayurvedic guidelines, food guidelines for, let's say, whatever form of dosha imbalance you had, let's say that nutritional therapy was compared to a conventional nutritional therapy. And that conventional nutritional therapy included the low FODMAP diet. And it was in 69 patients with IBS. And after 3 months, the people that were in the Ayurveda group showed significantly greater reduction in their IBS symptom severity scale compared to the folks that got the conventional nutritional therapy. And it was 68% of the variance was explained actually by this treatment approach. So those were considered to be pretty solid findings, but of course the N is still pretty small overall, 69. Then there was another study which actually looked at the whole system Ayurveda protocol versus just a single herb. So in this particular study, it was only the diet that was being changed. That was the only aspect of Ayurveda that was being implemented. There were no herbs involved. There was no attention to daily routine. There were no yoga asanas. Really, all of those would be included in a whole Ayurvedic protocol. But here it was just like one dimension, which was the diet that was being looked at. Here, they actually implemented an entire whole system Ayurveda protocol where they looked at each, they took 48 patients and they actually, all of them had an IBS diagnosis, and they actually did an individualized analysis of each person's constitution and then prescribed them, diet and a particular yoga exercise, and in some cases, certain kind of counseling if they were very, very anxious or aggravated. So each person got a slightly different, intervention among the ones that were available. So it was really being implemented as Ayurveda would probably be implemented in real life. Okay. And then that was compared to just a single herb treatment that had shown, which has actually historically been used for a long time and has been shown to be helpful for IBS type symptoms. So they followed these folks for 60 days. And the primary outcome measures were the IBS symptom severity scale and the IBS adequate relief score. And so in both cases, the whole system protocol was far superior to the single herb treatment. And so this just really emphasizes that when we do study Ayurveda, whatever results we get when we only study one dimension is probably going to be nowhere near as good as if we were to study the entire system as a whole. And then there's several other herbs that have been studied quite a bit in Ayurveda for IBS symptoms. One of them that you might have heard about a lot is Triphala. It's used for a lot of different contexts. It's basically, Triphala literally means three fruits, and it's basically an herbal product that uses these three fruits in a particular proportion. So Triphala has been shown to be beneficial for bowel health in several clinical trials, improving stool amount, frequency, and not having any adverse side effects. There's a whole bunch of other ones, which let's just skip through because I want to get to the other data as well. So let's just move on now to reflux disease. So I'm going to be just sharing a couple of studies that looked at GERD in particular, but we know that there's a big overlap between functional reflux and GERD. And so I figure that would be a reasonable thing to kind of share that data in terms of Ayurvedic interventions for GERD, because those are also going to be very helpful for actually just general functional reflux as well. Even if there isn't an underlying pathology the way that there is in GERD. So in this particular study, this was a clinical trial that compared an Ayurvedic formulation, which was called Ayurvedic. It's some proprietary Ayurvedic formulation, but it had traditional herbs that are used for treating this upward moving pitta, which is what we were saying that reflux correlates with, this upward moving amla pitta. And then they compared it with omeprazole in patients and followed them for 4 weeks of treatment. And here they showed the number of people that had complete resolution of their heartburn. It was about 42%, I think, yeah, in the Ayurvedic group and 57% in the omeprazole group. And they also had significant improvement in acid regurg, nausea, epigastric pain as well, and very favorable safety profile. But this study comes with a big caveat. Even though it was a randomized controlled trial, this analysis was done only with completers. They apparently had, whatever it was, like 12 dropouts. They said that the 12 dropouts were not related to any adverse events, but they didn't really explain why those folks dropped out, and they didn't do an intent to treat analysis. So this is a completers analysis, so it could be skewed. And then there's another treatment, very traditional treatment called Shankha Bhasma. It's actually it's prepared by taking a lot of conch shells, like from the ocean, and it's prepared in a particular way so that it can be ingested safely. And it's been used traditionally for like hundreds, probably thousands of years. And it's been shown to be effective in human, animal, and in vitro models, but hasn't been really clinical. It hasn't been tested in a randomized clinical trial design very much, but there was just one study that just looked at different dosages. So they compared one dosage of the Shankobhasma to another, but they didn't really have a control. So I guess the dosages were the controls for each other. So not the world's greatest design, but they were able to establish that the dose of about 300 milligrams is probably the most effective. And it needs to be taken with some kind of a sour base in order for the preparation to be active within the GI tract. Now let's take a look at functional dyspepsia. So as we're going down the list of these disorders, it's like less and less RCT data, but there's a couple here for functional dyspepsia. So these are both proprietary herbal formulas that have been tested. And because they are herbal formulas, it's possible to do a double-blind, classic double-blind placebo-controlled trial, because you can create a plausible placebo for these things much more easily than you could for some of the other procedures that are done, like say in a whole Ayurveda protocol. So anyway, in both of these, this particular formula, the STW52, this particular formula is actually, I think the study was done in Germany, I believe. It was done somewhere in Europe. So it was not actually done in India, and they didn't market it as being an Ayurvedic formula, but it was basically 7 herbal ingredients, and all 7 of them are used in Ayurveda traditionally for treating dyspepsia. So I'm just going to go ahead and include that here in this slide because the origin of those herbs is definitely from a very traditional source. So in this particular trial, they found that the herbal combination was far superior to the placebo after an 8-week randomized trial, and it had 272 people that were all diagnosed with functional dyspepsia according to the Rome criteria. And then there's another proprietary blend. This one was just done last year, this study. It was also shown to be highly effective compared to placebo in an 8-week trial of 40 patients, much smaller, 40 patients with self-reported functional dyspepsia. Both of them are promising, but certainly by no means conclusive. So in terms of future research directions, just want to say that there's obviously a lot of room for growth. First of all, designing them with larger sample sizes, longer follow-up periods, standardizing the herbal preparations perhaps. But like I said, Ayurveda is inherently doesn't lend itself really to the randomized controlled trial design. It's so personalized that I think the way to really do it would be to have those, like, sort of emulate the whole Ayurveda protocol, perhaps, against some other standard Western protocol, and then kind of comparing that to see what the outcome might be. But I have to say that genomic research and microbiome studies have really taken off. And it's just a huge topic. I actually did another Grand Rounds talk at the UCSF Osher Center. I invite you to listen to that. That was done back in 2022. But I will just highlight a couple of things here that just seem to validate the idea of Prakriti probably being based in some way in genetic and epigenetic phenomenon. So there was one particular study that really showed that Pitta dominant people, remember Pitta is that fiery, the element of fire, that there was an upregulation of inflammatory genes and also butyrate producing gut microbes. So this all aligns with Pitta's fiery nature. Vata, remember, which is made up of air and space and regulates the nervous system, they had an overexpression in the study of genes which regulate neuronal function and motility. Remember, peristalsis and movement is governed by Vata. And then it might also help explain why Vata is more predominant in some forms of IBS in terms of enteric signaling and so on. And then Kapha types had upregulated lipid genes, lipid metabolism genes, and Kaphas in general tend to be larger build with more tendency to put on weight and so on because of the water and earth elements. And their gut communities were dominated by a bacteria which is associated with sluggishness in terms of metabolic function. So just some interesting correlates here. And then that also, they also looked at methylation patterns and finding some really interesting correlations between what you might predict with Vata, Pitta, and Kapha and how methylation patterns and the stress response are sort of turned on or turned off accordingly. One of the biggest areas of investigation here is how herbal interventions actually turn on or turn off the expression of certain genes. And in one study, Triphala really promoted the beneficial growth of bacteria. And this is one of the ways turned on, like the expression of those genes, which allowed for those bacteria to grow, which is really one of the mechanisms of actions that is getting a lot of attention in terms of how these Ayurvedic interventions might actually work. And all these herbs, there's just all these fascinating studies of how these Ayurvedic herbs actually select for certain gut microbes to grow over other ones. So you're basically recreating the correct kind of microbiome through the herbs that you're taking in Ayurvedically for Vata, Pitta, and Kapha. And it's pretty just amazing that there was this like intuitive sense from this ancient tradition of which herbs do what to sort of correct a microbiome that's gone out of balance. And so once we have more data accumulated, it gives us like a lot more scope for being able to prescribe certain Pitta, Vata, Pitta, or Kapha pacifying herbs with particular effects on the microbial system and GI functionality. And I just invite all of you to kind of think about how some of these principles might be useful when you're thinking about your own patients and how you could apply these. If you could get comfortable with the idea of understanding just the basics of Vata, Pitta, and Kapha, you might be able to guide your patients better in terms of selecting for certain herbs, or at minimum, selecting a daily routine or exercise routine that would be tailored to their particular dosha. Or you could refer them to the Osha Center too. And I just wanted to close by just doing a little pitch for a yoga study that I'm currently leading. I know a lot of patients with functional GI disorders have depression. So if any of you have patients that have functional disorders or any kind of GI issues, and they're not currently taking antidepressants, but they're having mild to moderate depression symptoms, consider referring them to our study. And they'll be getting a dosha-specific yoga protocol to see whether we can actually target the depression symptoms based on Vata, Pitta, or Kapha. Okay, I'm going to stop right there.